September is Childhood Cancer Awareness Month. As a pediatric surgeon, I have walked through with many families through some of their most difficult days and also their most hopeful recoveries. Today, I want to share what every parent should know about childhood cancer that requires surgery, how we treat them, and why early action truly saves lives. Every year, thousands of children are diagnosed with cancers of the kidney, liver, lungs, or intestines or abdomen, which are completely different from those that happen in the adults. Childhood cancer grows very quickly, but it also responds better compared to adults to any kind of treatment that we give it. I remember a child with Wilms tumor. The parents were devastated at the diagnosis, but when we showed them the path of treatment, they took that path, and today, 3 years after surgery and chemotherapy and radiation, this child is so hale and hearty, going to school as if nothing has happened. That's the progress that modern medicine has done for childhood cancer. So what are the things that parents should look out for when we talk about childhood cancer? The first thing is a lump. Most childhood cancers present with a swelling or a lump, which may be in the abdomen, chest, or any part of the body. Sometimes there may be pain or just a fullness and not an obvious lump. Or there may be unexplained signs or indications that something is not right. A lot of these may be found when you are actually bathing the child or doing some routine daily activity. The most important part is to get to a pediatric surgeon quickly. You must always trust your instincts. If something doesn't feel right, please consult your doctor. There are some myths that I want to address today. Cancer is always fatal. Not true at all. With modern treatments, many solid tumors are completely cured. Another myth is that surgery actually spreads the cancer. In fact, careful surgery is often the step that removes the cancer and is the largest part of treatment of many childhood solid tumors. One of the biggest myths is that childhood cancer is extremely rare, and why should I bother to know about it? It is not as rare as we believe it to be. I see many children, a few every week or month, with tumors, and some of them turn out to be cancer. A lot of them are detected early and have completely normal lives after the treatment is complete. Our role as a pediatric surgeon is right at the beginning with the diagnosis. For any cancer, the first step is accurate diagnosis and what we call staging. Staging means trying to find out how much the cancer has spread. This may be done with scans like ultrasound, CT scan, MRI, and sometimes PET scan in children, or there may be a biopsy or blood test. Usually, we would want to do all of these within 24 hours to get to a diagnosis and staging. Once we have that, there are international protocols for each variety and type of cancer in a child, which would then guide us as to what the next best step is. For almost all the cancers that I deal with, surgery is required. However, today, modern medicine can actually make the surgery safer by first giving a little bit of chemotherapy to make the tumor a little easier to remove, and hence enhancing the long-term outcomes and maybe even reducing the need for later chemotherapy or radiation. During surgery, for example, on the kidney or the liver, we have to take out the tumor and sometimes some functioning tissue like the kidney or part of a liver as well. However, a good assessment is made for the lifelong ability of the child with the remaining kidney or the liver before any surgery is actually done. In smaller tumors, we may even use laparoscopy or robotics. Like for example, about few months back, we operated on a small tumor which was actually a cancer in the chest of a 2-year-old baby, and this was not very difficult and the child had a great recovery. We must remember that surgery is only a part of the treatment, and there is chemotherapy and sometimes radiation also, but there are also doctors who are good at reading the scans. There are doctors who are good at looking at the pain management, etc. So treatment of childhood cancer is a multimodal treatment or a multidisciplinary treatment. Of course, the biggest contribution is from the family, your expectations as a parent, and also what would the future be like for the child. Because with the right family environment, children can often bounce back very quickly from very large surgeries and almost have completely normal lives. And believe me, when you meet such children, it actually also encourages us and reminds us that cancer is not the end for children. It is a very major disease, but it can be very well and fully recovered from if early detection and early treatment is done. One particular child comes to my heart when I talk about cancer was a 10-month-old girl who had been detected with a lump in the abdomen, and that lump was detected as a liver cancer. In a 10-month-old, it is quite challenging because giving chemotherapy is not easy. The doses have to be reduced dramatically and surgery has to be really very good because the chemotherapy has to be little lesser. We did all the tests and scans very quickly within a day and decided to give a small dose of chemotherapy before the surgery. And then a very, very major surgery happened where we removed slightly more than half of the liver of the child. But our calculations were such that the child can live very well with the remaining functional liver tissue. The child made an excellent recovery. The child also underwent a chemopod insertion where we could continue to give chemotherapy from that port so that she doesn't have to undergo needle pricks all the time. And today she's a few years old. And once in a while, the parents still send me a message just to remind me. And this gives me a lot of hope. This September is Childhood Cancer Awareness Month. As a parent of a child, please help us spread awareness about it. Even though we hope that no child would have cancer, but more the awareness, more parents would be able to seek treatment very early and bring children with lesser stage cancers and have completely normal recovery with smaller treatments. Very importantly, never ignore any warning signs and your instincts. Thank you for listening. This is Dr. Kant Shah, Pediatric Surgeon. If you have comments or questions, then please do ask us in the comment section and we will respond to you. Thank you.